Did you know that leprosy cases are on the rise in the United States? It may seem like a disease of the past, but recent reports suggest that it's making a comeback, particularly in the southeastern region. Leprosy, also known as Hansen's disease, is a chronic infection caused by the bacteria Mycobacterium leprae. It primarily affects the skin, nerves, and respiratory tract, leading to symptoms such as skin lesions, numbness, and muscle weakness. If left untreated, it can result in severe complications, including paralysis, blindness, and disfigurement. Historically, leprosy was most prevalent in Southeast Asia, with over 200,000 cases diagnosed worldwide each year. However, in the United States, leprosy is considered rare, with approximately 150 to 180 cases reported annually. Yet, there's been a notable change in recent years. The number of reported leprosy cases has more than doubled in the southeastern states over the last decade, with Florida leading the charge. Central Florida accounts for a significant proportion of these cases, both in the state and nationally. Other states witnessing a surge in new cases include Texas, Hawaii, California, New York, and Louisiana. While these numbers may seem small compared to global statistics, what's striking is the lack of traditionally known risk factors in many of these cases. Leprosy in the United States previously affected people who had immigrated from leprosy-endemic areas. But now, a significant number of new cases appear to have been acquired locally, with no clear evidence of zoonotic exposure or other known risk factors. So, how is leprosy spreading? The transmission of leprosy is not fully understood, but prolonged person-to-person contact through respiratory droplets is the most recognized route. There is also evidence of zoonotic transmission from 9 banded armadillos in the southeastern region. However, many cases lack zoonotic exposure, suggesting the need to investigate environmental reservoirs as a potential source of transmission. The good news is that leprosy is curable with a combination of antibiotics for a year or more, but early detection is crucial to prevent complications. Therefore, efforts to increase reporting and research into routes of transmission are necessary to identify and reduce the spread of the disease. In summary, while leprosy is not a major public health threat in the United States, the increase in cases, particularly in the southeastern region, is a cause for concern. The lack of traditionally known risk factors in many recent cases points to the need for further investigation into local transmission routes and potential environmental reservoirs. Remember, if you are experiencing unexplained rashes or nerve damage, especially if you have been in an area where leprosy is common, seek medical attention immediately. With timely diagnosis and treatment, leprosy can be cured, preventing severe complications and further spread of the disease.